All right. So there's several parts of the system that we've kind of gone through for this pharmacy enhancements. Again, the main thing is to just clean up some of the workflows, but then also add a few features that are either new or something we're bringing over from the UVIS product as well. And I'm going to start at the kind of setup screens first and touch on those slightly, and then jump over into the patient record and show you kind of how that shows up in the patient record and in the pharmacy field records. So first of all, we went through the product setup and the pharmacy setup screens and made several changes there. And let's talk about that. So the pharmacy, first, we call it pharmacy setup. It used to be called prescription setup. We just kind of renamed that a little bit. So we wanted to try to clean this up and give you a little bit better view, along with there's a whole lot of new now options. So previously, setting up a pharmacy was really just giving it a name. Now, with some of the new features and also with lots of, so we kind of got feedback from the different schools about being able to set what requirements are adding those things. And so there's a number of new, and I'm not going to try to go through each one of these one by one. You'll be able to see that, but there's a lot of new options for requiring, say, total quantity. There's new daily supply fields. Do you want to allow approximate weights, things like that. So there's lots of new features here that you can turn on or off per pharmacy. So even if you have multiple pharmacies, some being a dispensary, some being full pharmacies, do you want to allow daily fills? There's lots of little options here that I would encourage you when you first spin up the 165 that you investigate what those are, set what you want your defaults to be, turn on those new features. To go along with that, we've also added in this version better support for the actual controlled drug machines. In the actual setup here, so I'm going to click on one of these here, and under the prescription setup side, there's, we tried to clean up these tabs a little bit as well, but there's now a new one I'll draw your attention to down here, which is the CDM setup. And previously, for the CDM interface, in the API, you would name or put the names in a comma-separated list of the different machines that you had, and there were some routing rules that you could provide in the API. Did you want the machine to only bill the charges coming from the machine, or did you want it to record it only? Or now there's an option for product setup. So you can, each machine that you name in VetView now, you can have these basic routing rules. So when a DFT message, they call it in the HL7, when that charge message comes in from the machine, what do you want VetView to do with it? The default is, and by default, the basic of everything, the choice you have to make at least is record. We're going to record every transaction that comes in, and it's going to show up in the CDM log. But you can then say, okay, I want it to bill these charges that come in, or I want to look at the product setup for what to do with that product. And this product setup is the one for schools that want to have it generate prescription records or medication records. You would want to set it to product setup. And you'll see in a second when I go over to the product setup that we have new controls for CDMs as well to help with that script generation process. One of the other things we added to this is that you can also turn on auto-decrementing from your inventory for CDM records. So as items are being pulled from the CDM machine itself, you can tell it that you want to pull it from, say, the pharmacy inventory area, and you can now make different inventory locations that represent the machine or a group of machines so that you can now, as we get further in it, one of the next big features that we want to look at renovating in VetView is some of the inventory model. And so what you'll be able to do is you'll be able to manage those machines as an inventory area or a cost center so you can transfer inventory into it and see it decrement out automatically as you pull from that machine. And that will also give you a better real-time snapshot of what should be in that machine through some of the reconciliation or audit screens that we have as well. And then also a target pharmacy for if you are using the product setup and you're generating scripts, you can tell it which pharmacy you want to target that script into. And so each machine can have different rules. And so you can now, what you would do is come into here and set all the different machines that you communicate with. And it's really the name that's important, because that's the name that we're going to find in the HL7 message, is the name that has to be here. So whatever you call it in that in the Pyxis or Cubex system, whichever brand you have, just needs to match this here. And that way it knows which machine to do. If it doesn't find it, it's just going to record it. It's always going to default back to just recording the transaction if the machine name doesn't match. There is a way in the CDM log here, just like if a product doesn't match, you will get an error if the machine name doesn't match. So if we get records in that the machine doesn't match, you'll see an error just like you would if the product didn't match, and then you could clean that up and process it through if need be. So again, that kind of goes along with this screen here. Now to go along with that, we've done some work in the product setup as well. So I like to always look at amoxicillin as my dummy product I always play with, or Clavamox, I should say better. So the Clavamox here in my sample, the other thing we did is we went through and tried to clean up the product setup as well. And one of the main things we did is we consolidated the pharmacy setup and the product setup into one screen. Previously in version 1.6.4 and before, you had to click a button to kind of jump over to the pharmacy setup of a product. And so now, just by clicking on that this is a pharmacy item, it will open up the prescription setup tab where you can put all of the prescription setup that you want to go along with, say, the inventory setup for this product or anything else that may go along with it. And so what we did here, when we consolidated this, we also added a couple new features at the same time. One thing we did is we gave you a place to put a nice, friendly drug name field that would be used automatically. So if I picked Clavamox, which, you know, because different people put things in your system, you may get a name in the system that's kind of abbreviated or has the unit in the name or something. And so this may be what you put on the bill or what you call it when you order it, but we wanted to give you something, a nice clean name, maybe a little bit more verbose name that you could have on the label, and that will default on the label for you when you put that on there, and that's what this is used for. If this doesn't exist, it's just going to use the name up here as the drug label name like it does now. Another thing we did is we also added a drug strength here, which we typically have put just in a string format of the name, and we went ahead and put a numerical field here with a unit as well. And the reason we did that is you'll see in a minute, I tried to make the drug calculator a little nicer so that it knows if I'm trying to hit a target dose and I've got a weight, you know, mgs per kilogram. It also now tells you how many tablets of the 125 in this example you would need to satisfy that. Is that 2.5, 1, 2, you know? And so just trying to make the calculator a little nicer there, added the drug strength there as well. And it's also where you set your drug class, so no restrictions or drug 1, you know, and that's part of this as well. This is also where we consolidated and brought in your drug profiles. I've mentioned this before. A feature we've added to VetView a while ago is that you can have pre-made, or I call them drug profiles, or pre-made labeling information. And so those, you just click on the add, and it basically gives you what looks like a script field almost, where you can give it a simple name. So you can say it's the once a day instead of twice a day. And the name is just used for the clinical staff who's writing the script to know which template I'm using. And again, you can use the draft terms as well to build your little template. So give 1 capsule, or maybe 2 capsules by mouth every, you know, once daily for duration for, let's say, 12 days. Draft that out. Always find little bugs. Nice. Here, 1, 2, now, 1, 2. And let's say for 12 days, daily quantity, 2. This is for 12 days. That should be 24. 4, 2 yourself. So you can create your different ones. You can also create a default, and you can also filter it by species. So what I wanted to do, it's not truly a formulary, you might say, but it can kind of work somewhat like a formulary where you can have some pre-made, typical ways of using this drug for this breed. Is it the default or not? So that either pops up automatically or not for them when they're actually putting it on the script screen. We also consolidated your draft term setup. And again, the draft terms, what this does for you is you can set the defaults so that if when I choose the product on the request screen, it can auto-fill in the draft terms for you. It can also shortlist it. So if you say filter my verbs, then it's only going to show me give, or the unit's only tablets, or only every 8 hours. If you turn off these filters, then what you're going to see is that when you go to prescribe it, you can choose from any of the frequencies that are in the system, not just the ones that are in the filtered list. So you can help, through setup, you can help make the system more efficient for your users. We also added and put more definition around generics in the sense that when you assign a product to a generic, you can see what other products use the same generic, but then once you select a generic, then your auxiliary labels or your handouts will automatically be assumed. So if I set up a generic with some handout sheets or auxiliary labels, you'll see the ones in blue are the ones that this product is inheriting from its generic, versus the ones that are not in blue are the ones that are added specifically for this product. So if you have your generic set up so that, please know that this is my test system and I've got a bunch of dummy data stuck in here. Obviously, you would probably not have 4 different drug sheets of different drugs on this product, but you could. But what that allows you to do is that if you set your generics up and then use your generics on all of the different size pills or liquids, then you don't have to go set each individual product up, but you have that override ability that if you need to add different auxiliary labels or want a different handout, to print with it, you can do that as well. We've also added in all of the interaction and warning sections so that I can actually start setting up the interactions between breeds and drugs or weights or ages or patient alerts. We even have a patient alert section so that if you have I don't really know a good one for animals, but I know for people you might have like a peanut allergy or something that triggers an antibiotic to have a cross-resistance to that alert that you may have. So you can do alert to drug interactions, product to product interactions, generic to product, by diagnosis, or you can have just a custom pop-up that happens if this product is selected for a patient. And that's more of like a confirmation or a warning that maybe you want to pop up. So like if you have a chemotherapy drug that really you want to warn somebody of something about it, you could actually create a custom interaction alert so that as soon as they pick it, it would pop up on the screen for them as something they need to know about. So we've taken a lot of time to consolidate and clean up this workflow of setting up the product, giving you good functionality here, hopefully, that you can see. But then also there's one other thing I'll draw your attention to, kind of going back to the controlled drug machines. We've also added where you can turn on the controlled drug machine option here, and this is where we were talking about before with the product settings. So this is where you can now put in your different, like a code that the CDM may know. So if the CDM machine is not using product codes, that's how UVIS used to work, is using the actual product line and sequence number. If you'd rather use some manufacturer code or NDC number or whatever, however it's loaded up in the machine, again, this is giving you a place to create that mapping between what the Pyxis or Qvex machine knows the drug as versus what we call it internally for billing purposes and medical record tracking purposes. But the other thing we did, not only do we give you this ability, we've given you the ability to override even the billing options. So we noticed a lot looking at people's product setups and things like that they were creating duplicate products in their inventory or in their billing system just because they want to bill the individual tablets or mills coming out of a CDM machine different than how you would bill a prescription. And so what this allows you to do is you can say, okay, for amoxicillin, if I'm going to prescribe it, putting it through my pharmacy, I'm going to have maybe, service fees, and I'm going to have some pricing with maybe a minimum here. But then if I'm getting it out of the CDM machine, maybe you want to have its price be, a little bit higher per pill price, maybe a different markup, everything can be different. You can have different service fees, different tax rates, different pricing here, and then you can kind of see what that would look like per pill, or if you got, 3 pills out or something like that, you could see what the pricing would be, what it would be coming out of the CDM machine versus what it would be coming out of, if I was prescribing 14 pills to go home with a client. And so we now have a billing override for pharmacy versus the actual controlled drug machines. Again, we're trying to help cut down on having that duplicate product definition, because whenever you duplicate the product, then your auto-decrementing isn't going to work, or product transfers, all that is going to mess up your inventory model as well. So we're trying to help clean up your product definitions and your inventory model and managing that inventory. Some of the other options that we gave you here as well is if you do want a particular drug to create a prescription. So if you get, say, amoxicillin out of the CDM machine, and typically I think it's more controlled substances this applies to, but in some cases schools want that sign-off to happen. So you can say, well, I want it to generate a prescription, or I want it to make just a medication record on the patient's screen, but doesn't need approval. Or you can say, no, don't make any of those, just let it bill it. But if it is going to make either a prescription or a medication record, you can now customize what the instructions are that the CDM uses when generating that script. One of the enhancements we've already got planned is we're going to have wildcards that you can actually have placeholder wildcards in the instructions, probably in the next version after the one that we're about to release. So you could actually say, like, attending doctor said give this every 2 days, whatever. You could have your own custom instructions and custom comments that get added to the script when it generates it automatically from the CDM machine. So we just tried to make this process smoother and better, again, to help clean up product definition and your inventory definition in the system. So that's the work we did on the setup side. So now what I'm going to do, any questions on product definition or setup of drugs before I jump over to the patient record and kind of show some of the changes we made on the patient record?
This is you, right?
Hey, Jeff, this is Landa from Kansas State. On the patient record that you just showed us, generate prescription or medication record or none, can we set that up by a user type for that CDM also? So like if we have a vet tech that's pulling out a controlled substance, that we can have it generate a prescription, but if it's a clinician, it automatically just goes?
So we don't have that ability, but we do have it that if you are on your employee record, you can have it auto-approve or not. So, a lot of schools who used to do script-generated, auto-generating had it based on just if there were a DVM or not. But we actually put a separate checkbox here that says if this person pulls it out of the machine, then it auto-approves it, and i.e. being the typical use case is of the doctor. If the doctor gets the controlled substance out, it generates a script and auto-approves it for them. But if the person who got it out of the machine is a tech, then it creates a script, but yet it still needs to be approved by the doctor, the attending.
Perfect. So then basically we would mark everything in that CDM as generate a prescription. Our clinicians would automatically get approved, and everything else would go into the queue for approval.
That's correct.
Jeff, two questions. The first is, are you able to totally ignore the output of one machine, of a named machine, to where it doesn't, anything that's dispensed from it does not go onto a patient record?
So that would be the option of record only. If you do record only, and so you can do that at the product setup level. So if I go back to the pharmacy setup here, so we will never completely ignore a data flow from a machine. But if you select the machine, so going back over here to the machine setup, if you take a machine and you say I want to record only, then what that means is it's going to put it into the CDM log screen you saw earlier, but it's not going to put anything on the patient's medical record, and it's not going to put anything on their bill.
Okay, that's perfect. So it records the HL7 somewhere in the database.
Right. It'll put it on in the controlled drug log machine here. This controlled drug machine search page. It will show up here against the patient, but it stops there. It doesn't try to bill it. It doesn't put it in the medical record if you want it to record only.
All right. Next question is, can that be done as well at the product level? Say they never charge this or never show this on a patient record, even though it's dispensed against the patient.
Yes. If you set the machine up to be product settings, so that was in that option here.
Not the machine, a product in the machine, such as a box key.
Yep. So if you have this set to product setup, and then at the product level, so over here at the product level, if we put in here key, so if they had some collar key in the CDM machine, that's exactly what some schools do, including Georgia. They may have their bandage collar key in here. What you can then do is on the CDM record, you can say that we want to not bill this and don't generate any patient record. And what that'll do is, again, it just records it, but it doesn't put anything in the medical record and doesn't put anything on the bill.
Awesome. It's all in setup.
Hey, Jeff, follow up on that question, because we use QVEX, and we designate a lot of the billing items and what hits the record through QLink, so the QVEX software. So how does that interface now with this? Like, which one trumps what?
So I don't have any visibility to that software you're talking about. I'm assuming, though, that in that software, it hits there first. That's the first, like the QVEX talks to that system, and in there you tell it to then either send it to the EMR or not. So their system would trump ours, because if you don't send it to the EMR in their system, it's never going to hit my system as a charging record.
Okay, so that's kind of like the first layer, and then once it gets to you, whether that's what we want to do with it once it actually shows up for the EMR.
That's correct.
Okay.
All right, so now we're going to jump over to the patient record and show some of the things we did on the patient record. I'm going to jump over to my dummy patient that I've been playing with all day, so there's going to be lots of pharmacy things to look at there. Similarly, on the patient record, we wanted to add some of the new features and also kind of clean up the process a little bit. Nothing dramatically different about the prescription generation process itself. The only thing I did is I relayed the screen out a little bit and also added a few new features. So first of all, we put the pharmacy at the top up here as the first thing that happens, along with the name of the patient and what is it, inpatient, outpatient, is it, what unit are they seeing, if there's a location of the patient, what room they're in. So we added that across the top there just for quick information, in case you don't remember what you're working on when you clicked on the button, or you don't want to have to like move the dialog box to find that information. I just stuck it at the top there for information. But then I put the pharmacy at the top because we've realized as we've kind of gone and evaluated what we had versus where we're going, the pharmacy became more important to driving functionality. So I put that at the very top. It still defaults automatically based on the pharmacy that I have on my user profile. So if I'm set to send everything to teaching hospital or to my CPC or community practice pharmacy, I, at the user level, can set what my default is. But based on the pharmacy that's chosen, the system turns on or off what you have. So one of the new features is the daily fill feature. We've added daily fills in again. Along with one of the other features is the ability to have what some people call a pending script or approve and hold script. But again, if I change my pharmacy, you may see that that changes. Maybe we don't do daily fills in the CPC dispensary, or maybe in other ones we do or not. So based on when you select the pharmacy, you may change what your options are based on that. So in that you can see is kind of the primary thing at the top. Along with these radio buttons, we now have, for lack of a better term, I have what we call the regular fill, a regular prescription, which is your normal, write it out, give a Clavamox for, 2 pills twice a day for 14 days. The daily fill, which is for those that haven't, didn't use that in UVIS or not familiar with that term is, it's the concept of the pharmacy preparing a daily allotment or a daily amount of a particular drug, and they refill it every day. So every morning they would, put together the 3 or 4 pills that you need for that day's worth of doses potentially. And what happens is, or the way it works is that when you say, I want to do a daily fill, you give a start date. I'm going to start it tomorrow. And it's always, we always think about it as tomorrow, because with daily fills, what I wanted to give you the ability to do and the visibility of is that you can say, this is for tomorrow morning. It's basically like orders. I'm going to start my orders as of tomorrow morning. I want the pharmacy to start preparing that for me every morning so that I have it tomorrow. Now, I did give an option for I need to request the first dose now. So if you're starting it, the daily fill part is starting tomorrow morning, but I need one now, you can do that and have the start now. If you know you're only going to run it for, say, a 5-day course or a 6-day course, you can actually put an end date in there. If you don't put an end date, it'll just keep refilling it until the animal discharges. And then once the animal discharges, it'll automatically cancel it as well. And then we have, let me step back. We have the regular fill, and we now have this new feature about hold. So the idea here is that if I click the hold option, what it does is it approves it like a refill and leaves it on the patient's profile, the patient's medical record, until someone releases it and says, okay, now they can do it. So it's kind of the scenario in the sense like you might want to write a script for a client and say, if you need this, call us and we'll fill it, or you can come back and get it, but I'm not going to fill it today for you. I'm just going to put it in your medical record. It's that concept. And it has an expiration, though. You can say you have 2 weeks to come get this. If not, it'll automatically cancel itself.
Okay, so that's not going to go on the pharmacy fill queue, right? Not on our hold screen, just the patient's medical record, right?
That's correct.
Yay, okay, good. All right.
And then I moved external scripts up here to the top. And so now for external scripts, you would click that at the top. It used to be located a little lower down here, and I decided to make it one of the primaries at the top because, again, it controls a little bit about what you see. And I'm trying to make the screen, like I've always tried to do, I try to make it a little bit more dynamic. So as you change options or do things, the screen hides or shows different features that make sense. So, again, that's just at the top there. And then, so the drug name here, so again, just like before, it's a product selector. So I can either type in the name. I'm going to use my same amoxicillin, Clavamox, again, 125s. And you can see now, like we were talking about before, here's my predefined instructions that I was showing earlier that I made, the once a day versus 2 weeks typical course. Again, those are optional things. They're not required. You don't have to set those up. But I went ahead and slid that over. I was trying to lay the screen out in a logical flow. The left-hand side here is your script. It's a regular fill. It's this drug. Here's my instructions. How much am I getting? Refills, that kind of stuff. The center section's all about just an aid, just helping with either dosing, my predefined instructions, my draft terms, things like that. So that's about the similar. That hasn't changed much. Just try to clean up some of the verbiage there. And then if I click on my predefined instructions, it can automatically fill in those things for me. Or if I click on another one, it can change it. You'll notice there's some underlining going on here. Again, those are things that I've said is required now. At the pharmacy setup screen, you can say I require a total quantity of daily supply, or I require, refill level is required as well. Those are also dynamic. So if I pick something that is a controlled substance, tramadol. Come on. System's running a little slow. Sorry, my demo system's running slow right now. Come on. There it goes. Oof. No. Let me do that again. Tramadol. There we go. So if I pick my tramadol tablets, if it's marked as a controlled substance, you can see all my refills go away. So again, we're trying to guide the user to have what they need and not feel like they can do something that's not legal, right? So they can't put refills on controlled substances. And that's set at the drug class level. So the drug class level, you set what your defaults are for those, for length of refill time and also how many refills are available. On that note, we also added, let me go back to my amoxicillin and clavamox example here. We've also added, as you notice down here, we've added the script expiration and the refill expiration. And it's probably hard to see on the screen, but those are actually a kind of a gray color. What that's showing you here is what the default would be. So as of right now, if I just hit the add script and approve it, and if they got filled the same day, then by default, my script would expire in 30 days, and my refill might be, a year. You can set the length of the typical expiration, your label expiration, some people call it, or your discard date. You can set that at the pharmacy fill or the pharmacy setup as well, what your default discard date length is. But if we wanted to provide it here, is one of the requests that one of the schools had is so that the clinical staff can set that if they need to or if they want to. So if I wanted to give them a longer expiration window, I could. Again, now the pharmacy can always override that. So this is just going to be passed to the pharmacy. If the pharmacy feels that that's incorrect or needs to change it, they can. But what this is showing is that the clinical staff actually set that value. Same thing with refills. Maybe they want to set it a little different. Now, we won't let you go longer than the drug class, but you can go shorter if you want to. And then we also have the withdrawals. One thing we did with the withdrawals is we made it more, it's not just days anymore. So if you wanted to, you could say 5, and then you can pick. And now I didn't make any assumptions. I went all the way down to seconds. I don't think you probably would ever pick a second, but you can say weeks, months, years, days, potentially even hours if you wanted to. But you can now pick your units. So you can say 5 weeks or 1 year or something. And now this is a little confusing because we have a concept of companion animal, but that's actually competition is what that's for, short for. So if you have show dogs or, competition animals, horses that you may be competing with, you can actually say that they shouldn't compete for, maybe, 5 weeks or something like that. So you can set your withdrawals as well at different levels than we had before. And so, again, just kind of trying to clean this up, making it a little, kind of the same kind of workflow, but just maybe a little cleaner, a little smoother. You can then add that just like you always have. It puts it over in the kind of the working queue over here, and then I can fill out the next script and kind of go through that process. I did move the prescribing doctor over here along with the approval password and stuff, just to kind of, for space reasons and just clean up. I just kind of moved it over here. But again, it's always going to default to the attending doctor on the case. And then the approval is the same as before as well. So that really hasn't changed a whole lot, and I can approve it. So,
Jeff,
yes.
About the daily script thing, you said something about how once the patient's discharged, then it cancels the prescription. Is that still going to mean there will be a daily record on their, like, let's say they got tramadol every day for 5 days? What's happening right now is that once it's canceled, it doesn't show 5 days of tramadol.
So the way we decided to do it is that each day acts as a small prescription, as kind of like a partial fill almost. And so it gets recorded every day. So you will see, if I come over here to the prescription tab, you'll see in the different, and this is kind of, you'll see like, here's my tomorrow orders, and then here's my daily fills from the past. So every day in the past, there may be a 17th, 18th, 19th, you know, as I did each of the daily fills.
Okay. So that once they're discharged, that stays that way, though.
That's correct. That's in their history. It stays that way.
Okay, because that was the issue I had before.
Yeah, and it automatically, and I know there was a request to make daily fills not have an RX number. I think that's wrong, and I don't really have any really backing for it, but I think every script should have some kind of RX number. So you can give it a special prefix, like DF or something like that, whatever you want to call it, and what it does is, it treats each one like a refill. So each day it has the same RX number, but then the refill count will just increment each day it fills.
Okay, got it. Thank you.
Jeff, can you explain one more time about what the script expiration is? Because when you said it was the discard time, to me that is like whenever I'm making a product like, say, mycophenolate suspension, and I know that that's going to have a discard time of 30 days, and I would do a product default, and it would automatically come up on my label. That's not what you were talking about, right? Can you tell me what the script expiration is again?
It is. That's the same. That's what it is. So when filling out when doing a prescription, this is the label expiration, or the discard date, some people call it. So it's on the bottle when you say that, you know, this is good for 30 days. Now that may not be, the pill itself may be good for another, 6 months. That's not the actual pill expiration. This is the labeling expiration, like when they should discard or throw away, like what you would put on the bottle for when they should throw it away or stop using it.
Okay. Because I just think the word script is a little confusing. If you wanted to use something like Beyond Use or BUD, all the pharmacists, we all understand what that means, or just product expiration for the label. But having a script expiration, we kind of think of that as different. We think of that as like a hard copy piece of paper, and when we use the word script, the prescription. So in most prescriptions, they'll expire after a year. Actually, some prescriptions, don't ever expire, but your client-patient relationship actually expires. So I consider a script a piece of paper, but it's just a terminology thing, I think. But as long as I know what it is, that's good.
Yeah, and when we go, I can pull it up now. So let me.
Yes, and thank you for that feedback, because we can try to consider some alternate, more clear terminology for that. So this is kind of when you wish to discontinue use for the client to no longer give the medication versus the actual manufacturer expiration of the product.
And that's going to get translated into this field here, which is that expiration date that you're putting on the label, is where that's going to basically translate down to in the process.
Okay, so maybe label expiration even, might make it a little more clear, since to me a label and a script are two different things. So, but yeah, that's okay. That's good. That's good. Thanks.
So on that. So the expiration date that you were just on is the same thing as the script expiration? So, like, that's where the pharmacist or whoever's filling it would overwrite it?
Right. So when they're ordering the script, they can they can either leave it as the default, which is this kind of gray color here, or they can set it. If they want to set it, it'll kind of go black, and it'll save it with the script. And then when it actually goes into the fill screen here, we show what they asked for up here, and that's what will default into the label down here, and you can change it if need be. If they say, you know, it's, for some reason they say it's a year, and you say, well, no, it's a liquid that is only good for 30 days, they should throw it away after 30 days, and you can override them and change it back or do whatever you need to do.
In my opinion, those labels then should match.
Well, you can change it if you want to up here. If you want to change it and set it to whatever, you can completely alter it.
Right, I mean the titles of that field. So if that script expiration is the same thing as the expiration on the fill screen, I think those should match. Like the nomenclature should be the same on both of those screens since it's the same field.
Okay.
Drug expiration is something that's being thrown around here. Just call it like drug expiration, so it's very clear that it's the drug, not the script.
Yeah. So, okay. Probably what I'll go with is actually label expiration or discard date, because to me, drug expiration or is this expiration, which is what's on the bottle, which may be a lot longer.
Jeff?
Yeah, I see what you're saying, Jeff. I like that expiration, label expiration, because you're right. The label might be different from the actual product that I'm using. Because if I'm using like a mycophenolate capsule, that capsule has a pretty long expiration, but my suspension that I'm making from that, that I'm putting on my label is shorter. It's 30 days. So I get you.
Start suggesting manufacturer expiration.
Okay, well, the manufacturer expiration is actually going to be up in the products level where Jeff's at now. The fields we're talking about would be a different date than what the manufacturer has on the label. But we definitely appreciate the fact. This is a great point for us to clarify, and we'll revisit it to provide a little bit of clarification before this is released version. Thank you.
Hey, Jeff? Yes.
Yeah.
I have a couple questions. When you say that the daily fill goes until the patient is discharged, does that mean discharge by the clinician or discharge by the bill?
By the clinician.
So it's the episode discharge, not the order close.
Yes.
Cool. That's probably going to be a problem. And then for the total quantity and the day's supply, you actually have to fill both of those in? You don't one or the other?
Yes, you would unless you're using the little calculator here. So like if I'm doing amoxicillin and Clavamox, my little example, if I clicked on one of these, it would auto-fill it in for me. Or if I was drafting it, you know, so if I said this is instead of 12 days, I'm doing, you know, 12 months, it auto-fills in the day's supply for me. You know, if I'm using either of these two tools, it will fill it in for me. If I'm hand writing it, then yes, you would have to put that in.
Okay, thank you.
All right. So a couple other small things. Let me go ahead and, before I move on, let me actually put in a daily fill here real quick and a hold. So let's just do Genocin topical. And then some kind of stuff. I'm going to say hold this until there. Add that. And then put in all right, so I just wanted to add a couple of those active ones. A couple of things you'll notice is in the little medication area, there are a couple new little indicators that show up here. So like you were saying, I think, Heather, you asked, is that it'll show up differently. It'll show up as an approved script, but it's going to have the word hold by it. So it's a little different than the actual hold status, which is what you're typically thinking of now, where you can actually take a script and put it on hold, versus this is actually an approved script that's just it's in the medical record as either pending or hold is what I did here. And then what they would do is like a refill, you would just come here and actually then click on it and release it to the pharmacy. So like a refill, or if I come over here, you can see it in my list here. Instead of like the refill indicator, they could come here and say release my held script, and that's when it would show up in the pharmacy queue to be filled once they release it. The daily fill, you'll notice here, it's got it started, and there's now, because it's in what we call the tomorrow list, it's in the queue for tomorrow. And this is kind of like, what we're trying to kind of show you here is that this little section of the pharmacy fill, or the pharmacy list, is really your orders for tomorrow, right? These are all the scripts you have on daily fill for tomorrow. And then you get a little icon if it's in approved. Yeah, these other ones have been canceled and filled already, but if it's approved, then as a clinical staff, I can still cancel it just for tomorrow. Now, once the calendar clicks over and it becomes part of today's list, it's now in the pharmacy's hands and you can't cancel it anymore. So you have up until basically midnight to add or cancel any daily fills for the next day. And then once the calendar clicks over, then the pharmacy owns it, just like approving a script. You would have to have somebody in the pharmacy cancel that daily fill if you didn't want it actually filled that morning. And so again, you just get an option to click on and say, are you sure you want to cancel your daily fill? You say okay, and it drops off the list and it's now canceled. So I think to speak to your point, Dr. Saba, is that either discharging it or until you click on it and say cancel this daily fill, either one of those would take it out of the list. But one of those two would have to be done, either manually canceling it or discharging your patient.
Jeff?
The other, yes.
Is there any way to turn that off? I guess I just foresee that being a big problem because a lot of patients leave the hospital and have paid their bills but aren't actually discharged from the patient list for days to weeks to months later. So I could see that overwhelming the pharmacy with daily fills for patients that aren't even here anymore.
Well, that's kind of how the system's designed, is to indicate that the patient's been discharged is to actually click the discharge button. So I don't know how else they would know the patient's gone. Now
I mean, a lot of people use the system leaving things on their patient list because they don't have test results back as a reminder, or they still have to write discharges. Usually, it's not until everything is finished that a patient gets discharged, even though the patient may have left the building.
Yeah, Dr. Saba, you may want to try to consider trying to find another medical record deficiency to rely on, maybe not verifying your discharge, so then that way it'll stay on your patient list, but you'd still be able to take benefit of the, the other functionality that comes from officially discharging in the system.
But then we also have to communicate with our referring vets, and so that's holding communications up as well.
That's not going to fly.
So we also have where you can have deficiencies at the lab level. There are other things that you can mark as deficiencies that would keep it on your patient list besides the status of discharge. But because this is kind of the way we envision, is that you would discharge a patient and it would stay on your patient list as long as something was holding in a deficient status. All right. So a couple of things that we've added in that section as well is in the medication section, we've tried to make the other stuff that's in there, and I say other stuff like vaccine records, controlled drug machine records, reported by client type stuff. We tried to make this a little clearer, and we separated them. So the things that the clients reported to you, so if they've stated that the animal's on HeartGuard, or it's had rabies vaccines, or those kind of things, those are now would be in this section. We did make it where controlled drug machines, items that have those medication records will show up here. and you can actually then label them. There's a new labeling option for all of these items. So, for instance, if you can actually do full vaccine records through this, in the sense that you can say, I want to add a medication, it's a vaccine. You can actually now pick your vaccine from the product selector. So if you actually want to say you're giving the 3-year modified killed virus, filling in lot, serial number, manufacturer, and expiration right here. And this will not only record that you gave the rabies vaccine, but you can also fill in your information you need for labeling purposes as well. So that can be used, the labeling fields can be used on any of the antiparasitics, vaccine, any other just general medications that were administered. That you can also, we have a new section for over-the-counter as well. Over-the-counter is a new section that you can turn on. Now, our example is Tylenol, which you probably wouldn't do as over-the-counter, but things like bandaging materials. So if you wanted to have, you wanted to be able to send home something like bandaging material with a client, but you needed to give them a little instruction, you need to be able to generate a label to go on a baggie, you can now do that here. So you can also, I'm sorry. Cancel that, let me start over again. So, over the counter. So like an e-collar or something like that. So you just wanted to, put a sticker on the e-collar, or you wanted to bill for the e-collar, you could. If you needed to record lot expiration, you could do that at the same time. But then what that really, some of the benefits is that gives you a label that you can print out. So when I save that, quantity 1, when I save that, it does a couple things for you. One, it now records it in the system. It gives me a label that I can print out, and you can change your label size and where it prints out and stuff. But then also, it billed it. And so if I actually expand this, you can see it put it on the bill, and it's pending, and that's the bill it put it on. So you can do it as an auto billing. You can use it for labeling purposes. You can record other things like lot number, serial number, manufacturer for those things that you need to, like maybe a vaccine record, those kind of things that you might want to include when you are billing for those items. So we just tried to make this a little cleaner, separating them in their own categories, and also giving some labeling features there. So the same thing if this was a controlled drug machine, so you got out of the controlled drug machine, you want to put a label on it to either put it next to the cage or potentially send home with a client, you can do that as well. All right.
How do we designate what's a OT over-the-counter?
Back in the product setup, you can flag those different things. They are in your medical record options here, you can set what kind of product it is.
Okay.
Antiparasitic, euthanasia, medication over-the-counter, vaccine, and that will filter what you can pick there, because we know we don't want to make it, which we're conscious that you don't want to make prescribable drugs available as over-the-counter, because we don't want people to bypass the pharmacy. That's not the point here. The point is there's those common little things that you want to put a label on and sell, but don't need to go through the pharmacy. So it's just trying to help clean up what's being pushed through the pharmacy in some cases.
Okay, great. Thank you.
Jeff, Star has a question.
Can I go back to a couple of things you were talking about, the controlled drug machine label? Or is that, everybody got labels that have the official labels on their controlled drug machines that you want them to go on out? I'm curious, when you're saying you're going to do a label, are you just talking about for in-house use? Yeah.
It's really however you want to utilize it, because this came out of Missouri, actually. Missouri wanted to be able to put a label on what came out of the machine so that when they took that with the patient to, say, ICU or other places, or if they wanted to give them the open tube of ointment, with the client, maybe, I don't know exactly how they're using it, but they actually had a secondary little program that sat next to the machine that they were actually secondarily typing up instructions and printing out a little square label to put on the packaging. And so,
for us, we have to have, you know, the where the pharmacy's located, all that information on anything that goes home. So I just wondered if somebody had done that, figured out how to do that. I was curious there.
Now you can. Yeah, you can customize the label to have as much or as little on it as you want. And so if you wanted to make a label that looks like a pharmacy label with address, phone number, date, you know, you can do that. I would still hesitate to say it's a full pharmacy script, because I think you got to be clear that we don't set up a loophole that people are just grabbing it out of the pharmacy and sending it home. But we wanted to give you a way that you could label something appropriately, just so it doesn't get lost. And so that's what this is doing for you, is that you can format this to be whatever you want it to say.
I got you. And that'll print off. Nothing to do with your Pyxis machine or whatever your Qbex are using. This is just something, an aside thing that's coming from VetView, right?
That's correct. It's just a label, just like your, kind of like your pharmacy label does, in the sense that you would have a printer connected to VetView somewhere. You could hit the button and have it spit out a label, either like a patient label. This would just be a CDM label or a vaccine label or over-the-counter label that you could stick on a baggie and put it next to the cage, potentially.
Hey, Jeff?
On the rabies thing, you have a slot there for tag number to be included? I was missing that a few minutes ago.
So we don't here, but if you added rabies through one of our documents, there is a spot for it. So just depending on how you use it. Now you could put it in one of these fields, but that's not what no.
Now I want to be able to trace that number and look it up later, because we trace our rabies by number, not necessarily, you know, they'll find a dog that you see the rabies number, and that's how they call back and ask, try to track back. We've got Auburn University and then number on there. It needs to be we'll pull that up. Or front desk, be a call. I mean, we already got that.
There was another question I was going to, yeah.
I was waiting till she got finished. Since you were talking earlier about how the machine will put a prescription number on it, it'll automatically go through when the vet does it, and then the tech, it has to wait for an approval. So whenever it hits there, that means it's been approved. Will it have that script number on the label that they're printing out?
Yes, if you have it auto-approved, it would have the RX number that was assigned to that script. If you have it generated as a medication record, it will still have a CDM number on it, which is what you see right now on the bill. So there's a difference between a CDM number versus the RX number. You only get an RX number if you have it doing an auto-generated script.
Okay, because, because if they send something home and put a label on something, if they're doing that, you know, for a drug, let's say they got out some amoxicillin and they were going to send it home with the patient, it would need to have a prescription number on it. So, is there a process for that? Does that flow work? Is there a process for that?
So, if they were getting out of the CDM machine to send home as a script, you would have to have had set the system up to have it auto-generate scripts, and then they could sign off of it, and then they would get a true RX number. If you have not set it up to do as a script, if you have it set up to just make a medication record or to just bill it like you currently have now, then you're not going to get an RX number. You're just going to get the transaction number that we have now, called the CDM number that we have.
Okay. So like for emergency overnight, we would need to create that function for them to be able to generate prescription numbers then. Is that correct?
So what you might want to do, and you would want to have potentially in all your products set up, you would want to have turn on generate a script, and then maybe in the CDM definition, only turn on the IC or the emergency CDM as to generate scripts, and maybe all the rest of them just generate bill only.
Okay. Okay. So we can go over that when we get closer to that utilization. Somebody can show me how to do all that. So that sounds reasonable.
Okay.
Thanks.
So to follow up real quick, Star, we have it, if you are adding like a rabies tag, like if you built a form that you added like a medical record form, you could have it record, we call it just a generic patient tag, but you can have this say rabies tag here, record the tag number, the day you issued it, and then you could have this auto-generate a medication record where you could then get a label and serial number and all that stuff. So if you're trying to record an actual rabies tag number, you would either have to do it through a document that you add, like part of your discharge or part of your history, or you would have to come and manually add it to the tag section of the patient record, where you can actually say, here's my rabies numbers and expirations and things like that. So you'd either have to do it through a document or from the patient's medical record for tags.
As long as there's a way to, we talk about reports or searches, I don't know how we differentiate there. As long as there's a way for us to search for that number and find that tag and take it back to the animal, we're good. If we
you can.
Put it in the comment, or if you put it on the other place.
Yeah. All right. So let me move on because we got several other things I want to show. So quickly on the pharmacy fill queue, we've done some work in there as well. So it starts with the queue itself. So in the queue, some of the main things that we've done is we've given you the ability to customize now the columns that you have displayed, the sort order, and even some other filtering options you'll see up here at the top here. So first of all, let me just show you the fact that you can now rearrange your columns. You can, so if you would rather have, the owner name or the patient name first, you can move these columns around, and it's going to remember it per person. So this is your personal preferences for this screen. So if you like to have patient first or owner first, or maybe you want the drug first, you can rearrange these columns in whatever order you want them to be in. But then you can also remove columns and add columns. So maybe I don't really care about the requested by as much as I want to know the prescribing doctor. So maybe I want to make the prescribing doctor the one that I want to see more to the left or right, and I took requested off by, because I don't really care who put the script in, maybe on this screen at least. So you can add, remove, and so if you click on add here, come on, here we go. So you can say I want to add columns. You get a list of the columns that you can add. So I had all but that one added before, but you can kind of mix and match. So again, so if your screen's smaller or if you don't want certain things, you can remove them. Again, you can set the sort orders, and every time it refreshes or every time that you come back to the screen, it's going to put it back the way you set it. So if you set it by sort, sort by date or sort by doctor, it's going to remember that automatically for you as you refresh the screen. But you can also, up here, there's little new options up here. The first one is kind of a user preference one. You can actually also say, I want to hide everything older than, say, 30 days or 1 month. So you can actually filter things in and out. You can also hide statuses. Like if you're not typically dealing with holds, you can actually remove the hold, or if you don't use daily fills, you can hide those sections. You can also default what is open and closed by default. So if you want the holds to show, but you want them to always be collapsed when you load the screen, you can do that. And that way, when you click on the screen and load it, it can be a little quicker for you, a little more responsive, because it's, especially if you're not showing anything older than, say, 30 days old, those things can be kind of, hidden off the screen, and that way you don't have to see them all the time. Going along with this, we've also added an admin feature here that you can cancel scripts that are, say, requested that are older than, the same kind of window. So maybe everything that was requested that's older than, 30 days ago or a year ago, you can actually auto-purge those out. And that way, again, cleaning up your queues, making the system more responsive for you. But you can also do this automatically. through the API. So part of the pharmacy setup over here, I go back over to the pharmacy setup real quick, you can actually say, and I actually have it open already. No, I don't. It's over here. You can actually say in your pharmacy setup that I want to auto-cancel unapproved prescriptions older than, say, 180 days or whatever day length you want in here. That way, again, you can go ahead and have the system auto-clean up for you, and that would happen every night. So every night, as things age, it would auto-purge out those things that were unapproved in the requested status. And so the API can do some auto things there, along with if you're using the daily fills, it will automatically make those every night, with the API as well. So that's the automated stuff in the background for you. But that goes along with the changes we made in the pharmacy fill queue. Let me get back to, I've got too many things open here. Here we go. So kind of going along with that admin tab here, you can, and you can do that for any status as well. So you can even cancel your approved ones out. So you can say anything that's been approved that's older than, say, a year old or 6 months or whatever window you want, you can actually kind of mass cancel things using this feature as well. There's also, this is where you can generate your list. If you're using the daily fill option, this is where you can also print your daily fill list, labels and or just a printout of those lists. And you can do it for those things that are approved or filled, and you can sort it, and you can pick a day. Which day are you looking for? Are you looking for my list for tomorrow so I can prep everything? Are you looking for the things that you're filling today because you're going to work through them? And you can have as an option for daily fills, you can also have it autofill the daily fill. Some schools want it to autofill every morning, and then they're just going to take that information and put it in the different dispensary cups. Or some people actually like to work through each one like a script and actually approve them one at a time as they're doing the fill of it. So you can do it either way, and this is where you can have it auto-cancel on discharge, or you can turn that off and have it always manual discharge or manual canceling of those scripts. Because some schools, again, do that as a review process, that they review it in their rounding and then cancel them in the rounding process each morning. And it's the clinical team's responsibility to do that. It just depends on how you want to set that workflow up.
So, the
yes.
fill queue that we're looking at, you said you can sort by any of the fields on the tab, but can you sort by two of them, such as the date and the patient status? Because we have a board that displays inpatient and outpatient differently. So
the date column is always gonna trump that because it's down to the second. Right. So it would have to be two scripts on the same millisecond for them to change any order.
Well, I mean, we're basically think of it as group by on patient status and sort by the date.
Yeah, I believe it does that. I think it does that automatically. Like if you say sort by status, it then puts it in
status,
chronological order from there.
Inpatient or versus outpatient is how we would look at it.
They don't. I have two forms. You're talking about patient status, not status, because he's looking at patient.
He's looking at patient. Yeah. Well, no, not even that. He's looking at is it inpatient, outpatient services. But we're going to have to look at that more, Leon. I'm not sure. You'll have to play with it and see if we can come up with if we do what you need already or not. So, but I need to keep moving forward. We've got some other things I want to show. Yep. So kind of the last, there's the other thing we've done is on the fill screen itself. I've done a couple things here. One of the first things is I've relayed the screen out a little bit to fit in a monitor of a certain size. So we tried to, oops, no, not that, sorry. All right, go away. Okay, sorry. To fit in a 1280 screen. So if you're using like a 17, 19-inch type monitor that's running a 1280 resolution, which is a kind of a standard for several years ago, this screen should fit without having a side-to-side or horizontal scroll bar at the bottom. You should be able to go top to bottom without having to scroll left or right at all. in addition to that, I also tried to clean up this kind of area here in the middle. And so really kind of breaking the screen up into sections. This kind of top section talks about the patient and owner, and then the status of the script and the who, like when it was started, when it was approved, who requested it, who approved it, kind of stuff here. This in the center is really what I tried to do is format it to look very similar, to be consistent with the options and the layout from the request screen. So you'll notice here is that it has kind of the same order and layout as the other screen. And if I hit edit up here, actually, yeah, sorry, Bill. If I actually hit edit of the script, it really is almost identical as far as structure and layout of like you saw on the request screen. So just trying to be consistent about that kind of look and feel, but also getting all the same options. So if I'm doing a non-inventory versus an inventory item, if I'm using the dose calculator or draft terms or any of those, all the same features apply. If I pick an item that is a controlled substance, then the refills go away like they're supposed to. All the kind of things that I have on the request screen also happen here as well. Now, also, we also made certain parts of the screen editable even without having to quote-unquote edit the script. Like you can change the patient status without having to edit the script. You can also, I added a new section called Pharmacy Fill Comments that you can actually write comments about the fill itself without having to use the comments of the script section. So if you're writing comments about the script or the fill process or making notes about it, this is really meant for internal pharmacy comments that you can write on a script, and they're editable at any point. So you can do that without having to hit the edit button up here. You can actually edit those and save them and just continuing to write those up and save those throughout the process. The pharmacy flag is just a kind of a tag or flagging system. So like some schools have like mail outs or other things, and they needed a space to kind of write notes, mail to client, or other kind of flags or things that you wanted to write. And again, this is all meant for internal kind of noting. I also have, this is where I'm showing the bill that it's going to go onto. So these fields here are editable without technically editing the script, but you can edit the script if you need to still. You can still come in here, do the editing of the script, correcting it, making changes if you needed to. That's all still there as well. I just tried to clean up the overall layout of it in here. I made the alert section a little bigger. We've also enhanced the alert system, so if you roll over the info dot, you can actually see the pending items now. We also actually have those alerts that show up from the patient, and the episodes are now grouped a little better. But I gave you more space to kind of give you good symmetry on the screen as well. Now, scrolling down, the billing and inventory section was the one that really kind of caused the right scroll to be an issue. I've cleaned that up now. It all lines up nice and neat and would fit in that 1280 screen again without having to use the left and right scrolls. But I also tried to make this a little cleaner here. If you have inventory in the system, it will show you what the inventory is. You can put in your tablets used. One of the features I did, though, is you put in, so say I'm using this lower bottle here, and I put in my 14 capsules. As soon as I enter that in and hit the enter key or tab out, it will automatically move the lot number and manufacturer down here at the bottom for you automatically. And if for some reason you did split across two bottles, you can actually use this little icon here it'll comma separate the list for you, and it knows not to duplicate it. So if you hit it multiple times, it's not going to duplicate lot numbers. It'll see if the lot number already exists or the manufacturer is already in the label and just have it once for you. So try to make that a little smoother. The other thing I did about the inventory section is let me go back here to the list and pick one. I want to pick one that doesn't have inventory preloaded in the system. So I think this pest product doesn't have one. And I'm going to start the fill on it. If there is no inventory loaded in your system for that product, it goes ahead and adds a default blank line for you so that you don't have to always right-click and add every time if you're putting in a lot number and serial number for your pharmacy. So those can be added as you are filling it out. And again, as you put in your quantities here, it automatically fills them in down here for you as you go. So again, just try to clean that up. You know, you can still do your other fees. So if you have any kind of fees or mixing fees or whatever you have, you can add those in. If it's a non-inventory item, it doesn't give you an inventory row, so it knows, smart enough to know that that's a fee, not an inventory item. It doesn't even show an inventory area. Then giving your total for you as well. So that's all the same.
Can I ask you a question about that? On that used part, is that deducting it from the inventory? And do I have to put that number when I'm putting that lot in expiration?
It's using this number for inventory decrementation purposes. So this is used for inventory, and this is used for billing.
Okay, so if I am putting in some things in the lot and expiration, is it going to, if I put no number in that used box, is it going to save my lot expiration and serial number that I'm putting in there if I put no number, like 0?
It will. It'll save it.
Okay, because right now it's not, so we're having to do something different, but okay. Okay, so it's not saving it.
Yeah, I'll double check that. I can make it save it. It's just.
Okay.
I'm not sure, anyways.
Okay. Yeah, we just had.
Yeah.
We were having a problem with that. Because we had to put a number, and then it was decrementing our inventory, and that's not what we were using those things for. So, okay. So, yeah. Okay. So if you could make that save, that would be great. Thank you.
Hey, Jeff, real quick, when you did the split fill, it automatically, or the expiration date that populated was the shorter of the two. Is that automatic, or is that something we have to watch?
That's automatic.
Like you had a May and a June, and the system will automatically calculate which one's the shorter one and put that in for the expiration date?
It does. Yeah, it does that automatically. Because I can only put a single date in there, I went ahead and had it pick the shorter of the two. So if I did pick the June 1st for some reason, 7, and it populated the July one here, as soon as I put the other one in, and now on the second one I have to click the button, but when I do that, it'll pick the shorter of the two. And the reason I had it where you had to click the button for the second one is because I don't know, I don't always know what you're going to want to do down here, and so I don't want to try to assume too much, but it is just a one-click here to make it pop in. All right.
And the same thing on the manufacturers. If they weren't the same manufacturers, both would be listed if you click that button at the end.
I don't think I spelled that right, but anyway, I did. Okay. All right, and then I changed the auxiliary labels and printouts a little bit just to kind of clean it up. So the same kind of concept, you can still pick it and add it, and it'll put it in there, or you can uncheck them. So you can have defaults and change the selection on it if you want. Same thing with the drug sheets. You can remove them or unselect them and save them, and as you do that, it'll auto-refresh those labels for you. Just trying to clean things up. Same thing just down here, just trying to clean everything up, make it look nice, look a little better, function a little smoother, those kind of things. The other real main thing I want to draw attention is that it used to be at the very, very bottom below this, there was a section for like the patient's history of pharmacy. Because of the screen length and everything else, I just put that here in its own tab. So now there's kind of these 4 tabs across the top. So if you want to see the patient's history, you just have to click on the tab and you can see that history. You can navigate to that history from here as well. But in addition to that, there's also now a refill history section. And let me go to a patient that has hopefully some refill history here. So let's go to Reese here. This is not a refill, so let me go to one that is a refill. So like one of these daily fills here, that'd be a good example. You can actually click on the refill history, and you can see all of the versions of that script, all of the refills that go along with the original, and you can click on it and see what they are, you know, when they were ordered, if they were rejected, why they were rejected or not, if they had a reason for rejection. One of the features I'm going to add, it's not in here yet, is also the ability to kind of select one of these and pull its instructions and products into the script that you're working on. The reason for that is we've had recently we had some questions coming about, like, if I originally ordered it for, say, a 500 milligram tablet, but at some point it got substituted for 250 tablets in the refill process, which one does it refill? Does it go back to the original 500, or does it stay with the new 250 ones going forward? And so what we're going to do is we're going to have it go back to the original, but give you the option that if you wanted to, that you could, within just a click or two, you could pull in potentially the alternate version of that, the 250 one, and use that as your current fill as well, just to get, so if you continue to have, you know, like say 500s are no longer available and you're going to have to always do 250s, you can quickly jump back to that version of the script without having to retype it each time. But again, just trying to show you the complete history of a refill for a script and kind of linking them all together and showing them to you here in a convenient spot. And the one that's in red is the one you're currently looking at. So I'm originally looking at the number 2 fill here. So the one that is the number 2 here. So in the history, it's just highlighting in red the one I'm currently looking at. The same thing is true about, I now have a pharmacy change log for a script. And so you can actually now see, you know, when it was created. And let me go back to a different one so you can see a little more history here. Let me go back to one of my, here. So I now have a change log that shows you every single change that happens to a script through its life. So there's not a whole lot here. And so what it'll do is it'll automatically diff in red or yellow, or red is the old version and blue is my current version. So as I click up, you can see, like, okay, this one went from approved to, was approved hold, and then I approved it, you know, and then I released it and things like that. And so let me find one's got even more history real quick. Let me go back to prescription patient history. Let's go to one that's been filled. Go to one of these. And so you might have everything from edited, approved, start fill, edited, I issued it, you know, maybe I made a secondary edit at the end. So I can kind of see every version of it there as I go through. And I tried to highlight what was changed. So if I changed, when I assigned the RX number or assigned the expiration date, lot number, fill number, those kind of things, you can see all those changes. And I try to highlight those changes of each version there. In red or blue for what the change is. And that's in real time. So if I'm working on, let me go back to my working one. So again, if I'm writing comments and saving it, or you know, you go over here and someone else writes a comment and you save it, each time I do that, you know, that's going to make a log entry. And so you can see that's what I typed, and then that's what I typed, and you know, you can kind of follow the history and see a differential of each time it was saved, what was changed in it. And so you get a kind of a full history of that script throughout the entire life of the script. A couple other things that I want to highlight. I also try to add in a checker for people overriding each other. I know that was an issue that came up a couple places where somebody would start the fill and somebody else would also start the fill, and they would both be working on it, and then like later somehow someone try to save and they get an error or something. And so what I did is I built in, and let me open up Firefox here and have 2 different browsers and try to simulate what happens if 2 people try to fill the same script at the same time. I put in a background check that every 10 seconds it looks for if somebody else has touched the script or not. And so if I go kind of pull this over here next to each other so you can kind of see what's going to happen. Let me come over here, load it up. All right, so I've got the same script side by side. So let me zoom out a little bit here. So they're both loaded. Say I come in here and I start typing, or I hit the Start Fill button. And so now on this left-hand side, I've actually started working. Over on the right-hand side, within 10 seconds, it pops up and says, hey, even without touching it, even if it's just sitting stagnant on the screen, it'll immediately within 10 seconds say, hey, Jeff Dukes edited this description. Please refresh it to see the changes. All changes will be lost. So I wanted to warn you that, hey, like someone else has touched the script while you were working on it. And at least gives you an opportunity that if you want to copy out what you were working on so you can paste it, but you do have to reload it to see the changes that were made potentially on the other screen over here. But I wanted to give you as early warning as possible that somebody else, you know, had started, you know, working on it. And as soon as they hit save, vice versa, it's going to pop up within 10 seconds. Sometimes quicker than 10 seconds because it's an average. It just depends on when that timer fires, when it hits it or not. But as soon as it notices somebody else has changed that record, it's going to pop up a warning and say, hey, you're now out of date, and you'd have to refresh to see the changes. So just wanted to try to build in as early of a warning as possible there of those potential conflicts. That's really about all I've got right now. I'm sure there's lots of little details I'm glossing over, but kind of that's in a nutshell, as quick as I can in an hour and a half, try to overview what all we've touched.
Hey, Julie, this is Julie at Mississippi State. We missed the beginning of it. So how does a clinician initiate a prescription on an animal that is not in the hospital on a prescription they have never prescribed before, on a drug they've never prescribed before?
So what you would want to utilize is our outside prescription screen. So if you do outside prescription, this one here, it works like the admission screen in the sense that you can identify the owner, the patient, the referring vet that approved it, so that could be an outside doctor, and then you can then write the script from there. And this can be a new person, so this could be Jane Doe that may or may not have a record with you. If it is, so if it is Miss Jane Doe here, you can use them, and then select the patient potentially if we've seen the patient. But if we've never seen the patient, you can add that in as well. So Fluffy here, feline, and then save that. And then you get the prescription screen that you can basically write in their scripts, whatever their details are, because you got to get the script in the system somehow. But the difference is that this is now not potentially an employee that's approving it. This is, you're going to indicate the doctor, the referring vet, who signed the paper that you're filling.
Okay, so I'm thinking more for a current patient. It is a patient of ours.
Okay.
So let's just say they've called in and say, hey, I want to switch flea products, and it's not a product they've ever had before, but we don't need to see the dog.
Okay. So all you would need to do then is, I'm sorry, I misconfused. On the patient record, let me kind of expand that back out. So going back to the patient record here, there's a couple ways you could do it. You could either, from the prescription screen,
like we can't see anything right now.
Oh, sorry, I'm not sharing that screen. Oh, I guess y'all didn't even see my whole demo with the Firefox, sorry. I had Chrome open next to it. Probably didn't even see that. You were sharing Google Chrome. Is that what I've got open? Yeah, here we go. Yeah. All right, can you see this now?
No.
No.
It's a black screen.
There we go.
Yeah, it's back.
So on the patient's record, there's two ways you can potentially do this. If you had a visit already open, you could just add the script to their visit tab, like normal, right? You could just come in here and add like normal. Currently, right now in this version, the only other way to do it is that you could take an existing script and say copy it, and now that's going to open a visit for you automatically. Because we have to have some kind of visit, some kind of bill to bill it on, regardless of it being done as a refill or a copy script or something else. You have to have an open bill and a visit to tie it to. So the CopyRx will trigger that automatically for you. And then once you click on that, then it's something you can click on here, edit, and then you could change out the product. You could make it a non-inventory item if it's something that's not in your products, you know, or if it is a product you have, then you could, you know, just pick it.
So if you get interrupted and you don't get to edit that, that already goes through for them to fill?
No, if you do a copy, it's just requested, and you still have to approve it. Yeah.
Okay.
Jeff, I have a question. On the prescription search field, whenever we're looking up prescriptions, did we add a species so we can look it up by species as well? Because sometimes I get asked a question, how many dogs from the beginning of the year got Entice, or how many cats got Entice? So like we did one recently for a doctor, and if we could filter that out by species, that really helps as far as a research organization goes.
So we don't have species and breed right now, or sex. We only do, right now we only have case number or name. We don't have anything else about the patient at the moment.
Okay, yeah. Just being a research facility when they're doing retroactive studies and all of that, so it's very useful to have a species filter on there. I had to look through 821 records the other day, and it had a lot of, and I was just looking for cats, which is only 10% of the scripts of those 800. So that was just a lot of searching. So a species, so I would request
we
that.
We have started, it's in our, I just assigned it to one of our developers this past week, is we're starting on our hospital query tool, where you will be able to look at species and breeds and patient information, demographics, and either products on a bill or medical record pieces. So that's also an option that may be available in the future.
Yes, because on this field screen, it's really good because I know those are particular products that got filled for horses. You know, so this is a good place to add that, at least the species. So, okay, cool, thanks.
All right, any other questions or comments?
Hey, Jeff, I wanted to ask one thing, and I may have missed this. You kept talking about controlled substances like tramadol not having a refill. Is that just something that are you asked to do that? Because we have a Schedule 2 with no refill, but our 3s, 4s, and 5s allow us to have it. Is that, were you just talking in general, or I was a little confused on that?
So in your pharmacy setup screen here, I'm going to, in your drug class definition, and you can define your definitions here, you can set the refill level, can they have, how many refills can they have, and then the length of time to get those refills.
Okay, that's fine. If I've got that ability, that's no problem.
Any other questions or comments?
I would like to, at some point, explore a little bit more the inpatient, outpatient. And other areas may not be having that problem, but we separate our field screens. You know, we've got people doing outpatient, we've got people doing inpatient. So it's something that it's almost would be overwhelming to look at a queue unless we can separate that. So I want to follow up with you on that at some point.
Okay.
large and small items. Yeah. Thank you, Jeff.
Jeff, do you have set up yet for the alarm to sound when a new prescription hits the work list?
Yes, that's in the pharmacy fill queue. Part of that user preferences over here. That's the first option at the top. Play alarm each time a new script is approved, basically as it comes in.
Jeff, in this version, is the student workflow for Kansas State, the dispensary, in this module or in this version, or is that coming later?
The dispensary one where you can fill it from the patient record, that's not in this version yet. That's probably...
No, like for the who's verifying the scripts, whether it's actually a pharmacist or if it's a fourth-year vet student?
You can already set anybody as an approver.
We'll talk to him later.
Okay.
So approver is defined by, so when you, in your user preferences or role management, you can define and you set by their role, or by person, you can even do it by person, you can set who is an approver. So you can say that this person with this role can approve a script.
Not approving, verifying the script, like once it's filled.
Issuing, that's also, you can do that at the pharmacy setup level. So when you're setting up a pharmacy, pharmacy setup, you say for each pharmacy you can dictate who your technician roles are and who your issuer roles are. So what this says is that you can have, like, maybe your pharmacy staff are not considered issuers. They can't say that the drug's filled and issued, but your pharmacist or your chief pharmacist is it actually who can press the button and issue it or fill that prescription. So you can put any named role you want and to be the issuer. And the reason we did it at the pharmacy level is because at your community practice, you may say your faculty and interns and residents are issuers, but in your main pharmacy, that has to be your pharmacist who does that action. Any other questions or comments? All right. Well, thank you for your time and your input. And like I say, we're in testing now of this, and we're going to get ready to release it here next week or so, and getting ready to get it out to everybody. So, thank you for your time.
Thank you, Jeff.